Good morning. Welcome to my channel. I am Nurse LaConda, and it is 10:51 on Saturday. I am working on call today, and I just got a call that was an emergency, and that's why I'm leaving out. But then when I called them, it wasn't an emergency. I triaged my own calls, because when I talked to him, the triage call was priority 1 call. That means priority 1 always mean emergency. Get out there, go do it now. And that means go right away, because they're in a lot of distress. So when I called, he talking to me regular. He don't seem like he in no distress. So I said, you know what's going on now? You ain't having a lot of pain? He said, no, not really. He said, I really need you to come out here to help me with my colostomy bag. This ain't no priority 1. This is a regular call, priority 2, not a 1. So I told him that I'll be there at 11. He was fine with that because he's not in distress. He just need help with his bag. He said it doesn't seem like it's on right. When you get a call at 3 o'clock in the morning because a patient in pain, and you ask them what do they have for pain, and they say nothing, and then you look at the diagnosis and they got like pancreatic cancer or something, and you be like, let me tell you something. They don't need it, they don't have to take it. But if they need it, it needs to be there. You would be feeling the pain that the patient in, and it'll be like, no, they ain't getting morphine. Girl, this ain't you. You ain't in pain. You don't get pancreatic cancer. For real. Have somebody else feel like you're not in their body. You're just a family. You're not feeling what they're feeling. Oh, I'm here to take my COVID test again before I go out working. I don't want that bad energy right now. I do not want that bad energy. Sometimes people could throw your whole day off with some bad negative energy. A little late for my testing appointment, but hopefully we okay. Oh, shit, here we go again. Okay, I'll come around. All my emotions tonight, I'm sorry. Rolling. How many more shots until you're holding? We just need Well, thank you.
You're welcome. Here,
and you don't want everybody touching your pens either.
Let me tell you where I got this from. Dollar Tree.
Oh, okay.
Dollar Tree.
Oh.
I'm telling you, they got some nice pens in there too.
Yeah, Dollar Tree be having some stuff, don't it?
Exactly. So they look $1.25.
Right, they done went up on us.
Yeah.
Okay.
All right, go ahead and let your window up, okay?
Okay, thank you. She was nice. I like the nice girls.
Okay, now there's no crying, okay?
No. God, this stuff be getting on my nerves.
That means you did it right. That's what that means. You get tears or you sneeze.
Right.
Did
it right. All right. Take care. Thank you. He said, if you get tears, you did it right. Well, shit, I do it right every time because I'm always tearing up. Got done with my first call. And there we go. Now I'm on my way to my second call, which is a death call, and it's right down the street, which is a death call. It's at a nursing home. I talked to the nurse, and she said that she's not talked to the family or anything, so they expect the hospice staff to do, hospice nurses to do that. So I'm gonna call the family and let them know, if they want to come up or whatever before the funeral home comes to get him. I don't know, because the family, it is on 80, what's this, 83rd and it's packed up here. They say the food is real good. I gotta try it out. We off Wabash, 83rd in Chicago. Black owned. It is. They got the sweet tea in the malls. And then they got It Is restaurant on 83rd and Wabash. A lot of people going. They're parking all down the street. It's packed. People outside. Don't let it get hot in Chicago, baby. Let me tell you, you get one nice day in Chicago, people be outside. Chicagoans get out when it's nice outside, baby. They get outside. It be quiet when it's cold, but baby, when it get nice, the streets is full. Oh, I just finished a death visit. Well, it's really not finished because The family is in New York. I didn't even recognize that area code, but that's the New York area code. So the family is in New York, and I've been trying to contact them and call them, left messages on all the people phones in New York, and nobody's answering me back. So we can't have anybody pick them up till the family is at least aware and agree to what they said. So I told the nurse at the facility that I just do everything over the phone, because I sat there a long time. So as soon as they call me back, I emailed the social worker. She gonna have to help out. In Illinois, we only have a certain amount of time that a body that's deceased can sit in a facility or in a home. So we on a time constraint. So my third call, I think I'm moving in good time. So I'll be there about 1:16 p.m. And this is just a regular visit. Taking a look at her, doing a checking of vital signs. When I go out to do a basic visit, I always go out, check their vital signs. I don't use those blood pressure machines, battery operated. I use a manual blood pressure. I just feel like those things do not work, but that's my opinion. So I go out and check their vital signs, make sure they're eating, make sure they're having bowel movements, make sure they're not dehydrated, make sure they're not in any pain, make sure they get all their medications, make sure their skin look good, make sure the family knows what to do in case of emergency, make sure the family is educated on how to get the medications, make sure the family is educated on how what they can eat and what they can't eat. And in hospice, we don't do G-tubes and things like that, so they'll let the patient get on a pleasure diet. A pleasure feed means that whatever they want to eat, just let them eat it. Hell, just let them do what they want to do. Of course, we're gonna do it safely. We gonna make sure they're not choking and coughing. But if they can have a little bit of mashed potatoes, give them a little bit of mashed potatoes. You could puree some food in the blender and let them kind of suck on it and let them do it. You know, sometimes when people dying, the muscles, the throat muscles get weak and they can't even swallow that well. The muscles just not working there. But whatever they could do, sip on some, lick on some, a popsicle, give it to them. A low sodium diet all their life, or a diabetic diet, they barely eat in hospice. If they get anything in them, we happy. When somebody is about to die, they don't eat. They don't want to eat. It hurt to eat sometimes. It's like painful to even eat and chew the food and process the food. That's a whole task in itself. So I always tell the family, if they don't want to eat, if they just tolerate a little bit, just let them do what they do. And that always means that when they stop eating, that just means that we're near. The time is near. Don't be going up in nobody's house fumbling. You better, if you know you going to a G2 visit, if you don't know how to do it, or you a little rusty on it, you better watch a YouTube video. Company should have YouTube videos on that subject for you. I know my company do. You can go to videos and watch stuff that you might not, because sometimes, you know, I've been a nurse for a long time. I done did everything, but sometimes if you ain't did it in a while, sometimes you do be a little, you know, rusty. That's normal. Even with these IV pumps sometimes, you know, and that's what I try to tell family members. Like, let me tell you something. Every G2 pump and IV pump is different. So I'm not going to go in and know how every G2 pump work just by looking at it. You know, I have to fool with it to figure it out, because no one G2 pump is the same. You know, I done dealt with a lot of G2 pumps over my career of nursing, and they, you know, depending on what job you work for, they use different companies. So I might get in the house and it's a G-tube I ain't used in years, and I have to figure it out. And I tell the family, be patient with me, because I haven't saw this G-tube in 10 years. Okay. So you just have to, you know, watch a YouTube video, but the basic concept of everything is the same. Flushing the G-tube and pulling back and see if it's any residual. All that stuff is basic stuff, but the pumps and different things will be different, you know, depending on what company you're working for. They use different manufacturers. So, okay, let me put up my phone, because I'm headed at my next visit. This is LaConda. I'm one of the on-call nurses. Yes, and I was calling you because, Mr. passed away. Did you talk to anyone at the facility yet? Yeah, he passed away this morning. Okay, okay. Oh, okay, okay. So what funeral home are we gonna send him to? Okay, so when I call them for them to pick him up, they probably will just give you a call back just to make sure. They always call the next of kin. But I'm going to give them a call now to let them know they can come and pick him up, okay? Okay, do you need anything else from me? Okay. All right, you take care, okay? All right, okay. Thank you, bye-bye. Okay, I'll let the nurses know at the facility that you will all be, could you give me an ETA so I can let them know? Okay, thank you. All right, bye-bye. I mean, who am I to hold your past against you? I just hope that it gets to you. I hope that you see this through. I hope that you see this through. What can I say? Please recognize I'm trying, baby. Oh God, I was debating. It is now almost 4 o'clock. I just ate lunch at Ain't She Sweet. Well, I'm about to see this last patient, then go ahead and go home. I did a lot of my notes while I sat in Ain't She Sweet. So Ain't She Sweet, I went to the one in Beverly. I keep saying Evergreen, but it's actually in Beverly on 95th and Western. And I usually go to the one in Bronzeville on 43rd. Going east toward, it's between Kings Drive and Cottage. I don't know, but I usually go to that one, but because that one is the best one. But this one was okay. I was able to sit down, eat, enjoy my lunch, eat slowly, and do and do my notes. And so that's the only thing I care about, because I don't like doing my notes at home. I try to get them done out in the field. Pre-COVID, I was cold at it. Pre-COVID, I never brought work home. But when COVID hit, you didn't want to sit in people's houses. Then the restaurants was closed. Well, they was closed to you sitting down. You couldn't sit down. So it was like I had to bring the work home. So I finally got in touch with the family in New York for this patient that had passed away. And she was okay with it, She knew he was trying to die, so she wasn't really, she said she set everything up. So I called the funeral home. I'm glad I didn't listen to that nurse, because it was not the funeral home the nurse told me. And so I called the funeral home, and they said they'll be there in about an hour. So I called the nurse and let her know at the nursing facility that they'll be there. And I, gave them all the information they needed from the hospice company. And so yeah, they'll be picking him up and shipping him back to New York. Oh, poor thing, poor thing. See, this is the thing. The daughter was upset because she didn't even answer the phone. So, and the auntie, the sister, which is his sister, who's handling everything, she was like, well, did you get in touch with his daughter? I was like, no, I left her a message to call me back. She was like, yeah, that's his distant daughter. They didn't have a relationship. He left the mom at 3 when she was 3. So she has she doesn't really deal with, she don't want to deal with it. And I mean, I don't know, like, if my daddy left me at 3 and I didn't really know him, would I want to deal with his ass when he finna die? Like, you left your kid, dude. May his soul rest in peace. But I know when I worked at the hospital, that happened a lot. I remember this man, he was about to die, and he didn't have any family, I don't think. Only number we had was this son. And this son, he told me, he said, no disrespect to you, but don't call my goddamn phone no more. He said, I don't give a shit if he finna die. Let his ass die. He said, I hope his ass burn in hell. I was like, oh my God. Like, it was probably worse than what the hell I'm saying. I'm just sugarcoating it. He was so, and he was like, this not towards you at all. He said, but I don't give a shit what's going on with him. Like, if he died, that's good. I hope his ass burn in hell. Can't, you know, I don't know what happened when he was a kid. Probably needed his daddy. And his daddy was nowhere to be found. Them kids resent your ass. That's why I say people need to be good to their kids. Because you don't know who you're going to need when you get older. Because from what I was hearing, that he was staying with a woman. And and the woman, when he got sick, she got rid of his ass. So his ass ended up in that nursing home. So don't throw your family away. I'm finally done. It's 4:48. I'm off right before 5. My end date time is 5. Good morning. Today is Sunday. This is the next day, and I got a call early. This is early for me. I got a call at 6:30 this morning. Glad I didn't go anywhere last night. I was able to get right up, so I'm on my way to this visit. It's a priority call. The patient is in pain. What happens normally in hospice, and this is something that nobody wants to address, but a patient will come home, or a patient will start the hospice service on pain pills that their primary doctor has have started them on, like a narcotic pill. Okay, they've been taking it for a while, and when they get on hospice service, the doctors will continue it. Some doctors will stop it and put them on a liquid. Some doctors will continue it. But what a hospice nurse always sees is that, and this happens very frequently, that maybe a month later on hospice, the patient is not able to swallow anymore. And they're taking the pills by mouth, pills, and they stop being able to, they're not eating anymore, they're not swallowing food anymore, and they're in a lot of pain. So that's the call I got today. Patient takes a Norco. Norco is hydrocodone and Tylenol. So a patient is taking that and has been taking that, and now she's no longer able to swallow. And so my job is to come out, assess her pain, do a full assessment, call the doctor, and get the medicine switched over to a liquid. But the problem with that is the patient is in pain. The patient is in pain, and we have to do the switch, which, yes, we can do an emergency pharmacy, or we can even have the family pick it up from the local pharmacy if that's possible. But it's still a process to be done. It still takes some time. Since the George Floyd situation, when they were doing the loot, a lot of the pharmacies do not house medications like that anymore. So sometimes we gotta call all over Chicago to try to find a pharmacy that have that stocks narcotic medications, because a lot of pharmacies, when the looting started, they haven't gotten back to having narcotics there. Switch them, and some don't. They leave them on it, but it never fails, either in the middle of the night or in an emergency situation. They cannot swallow it anymore. But a lot of times, a lot of the problems happen early morning or the middle of the night with hospice patients, when the body starts to slow down, everything. Nighttime is the worst for hospice patients. Oh, that call I just did, it turned into a death after I was there for a little while. I didn't want to leave either because I knew it was coming. And I was complaining about the medicine not being in the home. The doctor was complaining right along with me. He was like, this what really upsets me, that they keep these patients on these medications, and then when an emergency hits, we can't do anything. We have to do all this scrambling at the last minute, which that's what I did. So as soon as I got there, I called the doctor and got the medication switched over to liquid. He ordered some more medications also, And I was like, we're gonna put these orders in. This lady ain't gonna even make it to get these medications. I knew it, but we gotta do it. We have to do it. We can't just not do anything. And the doctor was like, give her the Norco rectally. So I had to give her the Norco rectally in her rectum. And it did help a little bit because she did calm down some, but that was just because she was finna pass away. Because you don't have to swallow. Oh, I'm just dinging. You don't have to swallow the sublingual medicine. She looked very pale. Her fingertips were blue. Skin looked mottled. She wasn't oxygenated properly. It's just a part of the dying process. Everything that was going on with her is part of her process. But she did pass away peacefully. She wasn't in distress or anything. And what was very good is that when I walked in the door, immediately I told her, I stepped out the room because even though the patient is passing away, I don't talk in front of him. I stepped out the room. I told her to step out. I said, she's about to pass away very soon. I don't know when, but it's coming very soon. And she said, oh my God. She thought she was doing something wrong. I said, you didn't do anything wrong. This is just a part of the process. She was really taking care of Mom very well. And so I told her, I said, call your family who you want to come, say their last goodbyes and come over. And she was able to do that, and they were able to get here before she passed away. The granddaughters were here. Her son came. So everybody came. And then she went on ahead and left. And so they had left out the room, and I looked. I said, she's gone. I didn't see no movement anymore. So I took my stethoscope out and listened, and I listened for over a minute. I just keep listening because I just always want to be sure. So no movement, no chest movement, no pulse, no apical heart rate, nothing. So I called the family in there, and I said, she's gone. And, and we went from there. I couldn't even put on some eyeliner this morning. Brow, nothing. No brow. Only thing I got on was some chapstick. I couldn't get no brows on. No, that's the thing. If you a type of person, you gotta put on makeup before you walk out the door. This ain't the job for you. Cause some days you ain't gonna be able to put no makeup on or none of that, especially no full face. This is not the job. You gotta be ready to just bounce up out of there. So I just did my second visit. I got one more, and I called them. They're fine. I'm just gonna run to the office. Hopefully my ID's badge is working, cause I need some damn supplies. It is so doggone. They don't call this the Windy City for nothing. I just almost got blew away, and I'm a big girl. Took away from the wind off my feet. While I was waiting on the family to decide on what funeral home they were going to use at my last visit. I'm looking at my paperwork. I'm like, where is my notes from yesterday at? Because I was going to just finish them while I was sitting there waiting, because the family was like trying to decide on what funeral home they were going to go with. And sign the papers and say you're going to do it. I think you should start thinking about that at that time. I know that's a hard thing to do, but I really think you should start thinking about the funeral home you're going to use and get that type of paperwork in order, and talk to us if you can't afford to bury your loved one, because a lot of people just can't afford a funeral. Then you need to talk to the social worker ahead of time, like what options do you have, to bury your loved one with limited cash or whatever, because some people don't have policies, life insurance policies. Some people, family, have to pay for those funerals out of pocket. So I feel like when you sign the paperwork, when they decided, because when you decide to go on when the decision is made to go on hospice, usually that means that the doctors kind of done tried everything, and nothing's really working. So let's just keep the patient comfortable. Or the patient decides to say, I don't want nothing else done. Like, just let me go in peace. Then that's when hospice come into play. And when that happens, I think family or whoever's running things should start thinking about what funeral home you're gonna use. Just the funeral stuff, because some people do really big things for their loved one when they send them home. Some people don't. So I think all that needs to just be thought about. instead of scrambling at the last minute, because I think that's what that was what was just happening. Like, so it's a lot of moving parts to this, but the only thing what I'm talking about is just to be prepared when you know your loved one's starting to get sick and they're starting to have a decline. It's time to start getting serious and getting paperwork and everything in order. It's start to get paperwork in order, bank information, housing information, all that stuff. It's time to start working on that. I just think that people should have their power of attorney of healthcare, power of attorney of finances, everything in order before they get sick. Because when they get sick, it's a big damn mess. Please work on that when you well and your mind is there. Make sure you have the people in charge of everything that you trust. So it won't be a big mess at the end of life. So I thought this was gonna be an okay, easy day, but it's not looking like it. They just dispatched me for another. I had one more visit to go. And they just dispatched me for another priority one. This is really far. Oh my God, this is far, like this is like northwest side of Chicago. These nursing videos that I make is educational purpose only. Just cause, you know, some people might not know, want to know certain things. I just made me a Whole Food run and a Trader Joe run before I do my last patient. My last patient is just a regular visit, and then I get off at 5. So I'm gonna go ahead and let her know. I had to call her back until I got diverted to emergency, the last visit I had. So she was like, cool, no problems, nothing going on, we'll be here. So cool. So let me go see that lady now. Alrighty. I'm shining again. It's not hot outside, so I don't know why. It's actually cold today. It was nice yesterday, like 60 something. Yesterday, Saturday, Sunday, it's like 30. We was all geeked up and it just switched on us. The wind was blowing really hard today. But I'm done for today. I saw my last person. It is now 4:30 and I'm on my way home. Just make sure the patient's eating, having bowel movements, not in any pain. I did a full body assessment. She does have a wound. We addressed the wound. The granddaughter is the caregiver and she's really good. I love when family be on top of stuff. She's very on top of it. So that was a quick visit. So yeah, if you like this video, and my videos, even though it's based on nursing things, I still give out information for people, for family members to understand things too about, you know, the care, because everybody in their life is going to have somebody in their life that's going through something, some type of illness, some type of ailment, and you can get some information from these videos to kind of help you navigate. And also you could throw a comment in there, and if you got a question, I could try to answer it the best. A disclaimer, you still will probably have to talk to your doctor about anything, but I could try to give some direction on something that's, you know, simple if you ask me. So please just subscribe to my channel, like my videos, and you know, I'm gonna keep trying to make content. I've been wanting to do videos for a long time, and actually if I'd have did it when I wanted to, I would have had so much damn content, because that's when, you know, you were doing a lot, especially pre-COVID, when you were going everywhere and doing everything, and I was so scared to do it. I was like literally petrified to start a channel. Like, I'm gonna be so embarrassed, people gonna be looking impressed, I'm gonna talk to myself. It's like every negative thought can go through your head, but honestly I wanted to do this a long time ago. I finally got the courage to do it, and I'm learning. It's a learning process, of course. Other side of nursing, a lot of people don't know about hospice. Hospice is one of those things that, you know, that's not really the hospice is not a field that nurses be like, oh, when I get out of nurse school, I want to be a hospice nurse. Yeah, it's not one of those glamorized fields like a lot of nurses be like, I'm going to peds. I talked to somebody yesterday. It was like, my daughter's in school to be a nurse. She want to do pediatrics. I'm like, that's good. I tried that and and that's a very sensitive. Shout out to the nurses who do peds. I know when I was in nursing school, I used to be a sitter for at the pediatric hospital, because my hospital had a pediatric hospital and a regular hospital. So when I was in nursing school, I sat with the patients. That was my job. Was like doing little side gigs, and I was a sitter. A sitter is like when you sit with the patient your whole shift. You sit there with them, because either the babies, they be snatching stuff out, and they all over the place. You know, they hyper, the kids want to play, so they snatch the oxygen out, they snatch tubes out there. I mean, they be all over the place. But anyway, when you do that job, you do get attached to those babies. You get so attached to those babies. And so when I was in nurse school, I did that a lot, and I had got attached to those babies. And then when a baby passed away that you attached to, oh my God, they would have thought I was the child mama. I was so distraught. Like, literally, I was so distraught. It took me a minute to get over that. So I was like, you know, this is not for me. Pediatric nursing is not for me. I learned early on, before I even graduated, that pediatric nursing was not going to be my calling. Because, man, I got to give shout out to them nurses who do peds and kids and adolescents and all that, because I cannot do it. I would be so attached to those kids, and that's what happened. I was so attached to a baby. Well, he wasn't really a baby, he was a toddler, and I was so attached to him because I would sit with him all the time, and I would talk to his mom and and he passed away. I was so distraught, and they literally called me at home and was like, LaConda, such passed away. I'm like, you're fucking kidding. No, that was it for me. I was like, no peds for me. Still don't want to hear that they passed away. So shout out to those nurses who deal with kids. Shout out. I know at one time for hospice, they were saying we was finna start doing pediatric hospice. Could you imagine? I can't even imagine me doing pediatric hospice. I'd be crying when the young folks die in hospice that's in their 20s. If a baby, I can't do it. And they were talking about doing it, and I was like, I wouldn't be able to stay here. I told them, I was like, I will give my resignation, because I'm not. Come to my channel and get some, you know, ride with me on these visits, and I'll give you, you know, as much information I can without violating the HIPAA. And that's it. So like I said, thank you so much for watching my videos. Thank you. And I am so gracious for the little bit of people I do have watching my videos. I'm so thankful for that. Get better and stay humble, and that's it. So thank you. Bye-bye.
Keep on walking straight.